Okay, so this is the webinar for biofeedback applications in healthcare. I'm Harry Campbell, Biofeedback Resources International. We provide training and equipment for biofeedback and neurofeedback. And during this session, I'm going to have a couple of people calling in, but I wanted to get in here, and this is what we're going to be talking about: 4 common and effective applications for biofeedback. We have tension headaches, we have anxiety, insomnia, and ADHD. So I'm going to be going through this, and the callers that I have calling in, as soon as you get on the line, just let me know, and I will get to you. All right, so biofeedback is where we use instruments to measure signals that come from the body, like muscle tension, heart rate, brainwave activity, breathing, and we use this to help people reduce stress and pain and so on, and focus and improve their attention. So, what does biofeedback do for healthcare? It provides a non-drug alternative for patients. It improves patient outcomes due to self-regulation, training the body to stay well. And much of healthcare is now moving from a illness model to a wellness model. So rather than waiting for people to get sick, we're trying now to keep them well more, and hopefully that will be part of what will decrease the healthcare costs. And then for a practice, it can increase income due to the added services. So some of the healthcare services that use biofeedback um, would include mental health. So that would be like psychology and other mental health, other services like mental health counselors and social workers and so on. And then you have pain management. So that can get into headaches and neck pain and back pain and things like that. And then neurology also can deal with headaches as well and other issues. So this is what biofeedback looks like. Um, you see, we have on the left side, we've got the image, which is a diagram showing how the person is hooked up to the sensors, and we're measuring the activity from them, feeding back the signals that are being measured, and they're learning how to control them. I'm just going to pause for a second here. Did I get a call coming in?
Yes, you did. Hi, it's Joanne.
Hey, Joanne, how you doing?
Hi, I'm doing well. Harry, how are you?
Good, good, good.
Good,
So
good.
I was just getting into talking about some the process of biofeedback, and I figured, you know, rather than just me talking about it, I wanted to get another real live person that has had some experience in
Mhm.
using biofeedback. So just you probably just finished doing a bunch of biofeedback today, right?
I have. Yep.
So just tell me, how long have you been doing biofeedback?
um, let's see, I started in 1985. So
Wow.
don't add that up.
I think we actually started around the same time. Wow. Okay. So
Yeah, I was gonna say. Yep, I think I met you probably maybe a year or two after that.
wow,
Mhm.
amazing.
Yeah.
So
Yeah.
the things that I'm talking about today with the in the webinar are just
Mhm.
4 applications I'm focusing on, and I've got someone else that's going to call in and talk about a couple of things. But from your experience, I believe you have done a lot of work with headaches and
Yeah.
also with anxiety. So I just wanted to just have you talk for just a few minutes about some of your experience with that.
Okay. So, what we see, the use of biofeedback is that it assists people that have whatever medical condition it is, whether it's headaches or anxiety or chronic pain, in a couple of ways. One, to regulate their nervous system activity, to learn how to regulate autonomic functioning, and to decrease musculoskeletal tension and all of the aspects that are under behavioral control that influence that condition. And it also helps them identify things like how thoughts and feelings create physiological change so that they can make changes in their lifestyle or address things that may be contributing to their condition or poor health or poor management of that condition. And lastly, I think if it assists people who feel really out of control in their lives or in their bodies, that things are occurring viscerally, that they feel out of control of that, it gives them a sense of being empowered to do something to help themselves become comfortable. I found that even if the biofeedback doesn't assist people to necessarily reduce pain, let's say they have several different pain conditions and their pain level doesn't necessarily reduce all that much. If they had started training at a level of 7 or 8 pain and they finish maybe at a level of 6 pain, what does really significantly change is their sense of well-being, their sense of another level of comfort in their body that competes a little bit with the pain, and their functioning improves because they learn how to manage their energy, they learn how to manage their stress, and they can function along with whatever condition it is. Biofeedback is extraordinarily helpful with people that have all different headache conditions. I treat vestibular migraine, vestibular issues. We're doing a lot of work now with the neurocognition and pain related to concussion. It's very effective for migraines, and it gives people something to rely on within themselves that they can do to comfort themselves or to reduce their pain or to prevent it from happening.
And have you found, like with anxiety, the people getting a better sense of just being in touch with what their body is doing when they are thinking what they're thinking?
Unbelievably so. Because what you're doing with the biofeedback is giving an objective measure to what they're experiencing. So first of all, it almost kind of demystifies it. You know, when people have anxiety or they have panic attacks, it's so frightening, you know, so that adds another level to it. It feels like something is happening in their body. They don't know what it is. They feel like they're unraveling. They can't get control of it. But when you actually see it on a computer screen, and you can see that, you know, by doing certain things that you can objectively, measurably reduce that.
Right.
It kind of makes it a little bit more concrete in a way, and helps people be able to know that if they stay with the breathing, if they do specifically what they saw being effective on the biofeedback screen or with the feedback, that they will get to a place where they will feel more in control, and they will get to a place where their nervous system will quiet down.
Right.
I think the other thing that's effective aside from the feedback is really understanding what anxiety is. So if you give a little, I feel it's very important as part of our practice to educate people on the autonomic nervous system and the neuroscience behind,
Right.
why we do what we do. Everybody comes in and says, oh, yes, I know people have told me to do breathing exercises and people have told me to relax.
Mm-hmm.
But when they really understand what the scientific mechanisms behind it are, and they can witness it on the screen, and they can witness their power in being able to change it,
Mm-hmm.
it really helps the learning curve soar.
Right. Well, great. I really appreciate you calling in after a long day. So
I'm
thank you
happy to.
so
Thanks for
much.
asking me.
Well,
Sure.
I couldn't think of many better people to call than you. So thanks again,
Oh,
and
thanks, Larry.
we will be in touch.
Okay, great.
All right, thanks. Take care.
Okay.
All
All right,
right,
sure. You too. Bye-bye.
bye. So, yeah, so I figured it would be good to just kind of get somebody to talk about their experience, and that was great. And as I talked to some of the people that I know in the field, I always learn more. So that's I appreciate her calling in. So again, this screen that we're looking at here is a example of what the patient would be doing. So they're learning how to train their own nervous system to become more balanced through feedback on a computer screen. So as far as effectiveness, there's a lot of information that shows that biofeedback is effective for headaches. One of the things that's used for headaches in biofeedback is EMG biofeedback, and that's something that measures muscle tension or muscle contraction, which is often very related to headache pain. So, compared to relaxation therapies alone, EMG biofeedback was shown to be more effective. Here, the National Headache Foundation Standards of Care for Headache Diagnosis and Treatment in '99 found that biofeedback has been shown to be an excellent treatment in the long-term management of migraine and tension type headaches. Here, a review of more than 100 studies found that biofeedback, relaxation training, and stress management training produce an average 50% reduction in headache pain. And this is just an example of what it looks like to have EMG sensors placed on the forehead for measuring muscle activity. So these just stick on like a Band-Aid, or if you've ever had an EKG done, there's similar types of sensors that just stick on. You don't feel anything, they're just measuring the muscle activity. And then the person looks at a screen and they're able to learn to have more control over their muscle activity. This is additional information on work that has been done in EMG, in biofeedback for headaches. So one of the advantages that biofeedback has over some other medical treatment is that it can produce long-term remission of symptoms, but it also can do that without side effects. So often medical treatment, even if it's effective, it may have side effects that are not desirable, like weight gain, sedation, um, interference with concentration, and so on. And then some medications for headaches will lose their effectiveness over time. The rating, there's a scale for rating how effective biofeedback is for various conditions. And this document called Evidence-Based Practice in Biofeedback and Neurofeedback has editions that came out in 2004, 2008, and 2016. And it rates out a scale of 1 to 5, and 5 is the most effective. So biofeedback for headaches comes out as a level 4. So that's pretty good. The next thing I want to talk about is anxiety. And there are studies that have showed that biofeedback is effective for anxiety as well. Different sample sizes and so on, and also biofeedback is often combined with other modalities as well. Here it shows some information on a group of high school students that had anxiety issues, and the results showed that a significant improvement in the anxieties, somatization, and depression in the treatment group compared to controls. And then there are many references for this. Here you can see some of the references listed here, and the references continued. More references for anxiety. And so now we've covered headaches, and we also covered anxiety. So I want to just talk a little bit about the business side of this. So potential income from biofeedback. Let's say what is often done, a stress assessment at the beginning of treatment that can be between $150 and $250. After that, we would often do 12 sessions, and that can range 75 to 150. Some people charge more. Often people do sliding scales and might charge a little bit less in some cases. Then if you do a post-assessment, and then for that patient or client, you can have a average of 21 to 2,300 per client. And if we estimated 30 clients for the year, then you see that's 63 to 69,000, and that's added to whatever you're already doing. If it's something that you're interested in starting, I would suggest that the first thing you would be doing is getting trained. There's something called BCIA, which is a certification that's available, and the first part of that requirement is to get trained. The training programs that we offer are $11.95. Equipment, there are many choices, but it ranges between about $2,000 and $6,000 for equipment. And then there's mentoring and support that would be helpful in you getting more experienced and comfortable with using your equipment and doing biofeedback. The certification fees with the exam and so on are about $425. So if it's something that you are ready to go forward with, then you can contact us about training, registering for training. Those are the phone numbers there. If you mention this webinar, then we'll give you an advertised discount. The schedule for the training is on our website, biofeedbackinternational.com. And I think we may have our caller in. Is that you? Can you hear me?
Yes, it's Susan.
How you doing,
Yes.
Susan?
I'm well, thank you.
Good. All right, so I was just getting into starting to talk about insomnia and ADHD, and I figured that you may have some experience in those areas and might be able to just talk a little bit about your experiences in using biofeedback and neurofeedback with those kinds of clients.
Absolutely. We'll start with insomnia because if you can't sleep, you can't concentrate.
Right.
So for insomnia, we always start with some self-regulation breathing training with peripheral biofeedback, such as skin anxiety measurement, skin sweat, and or HRV, heart rate variability. And once the breathing gets synchronized with the heart rate, or if the skin activity is reduced, and we see the self-regulation, we know that the client can build sort of a confidence level in their ability to do biofeedback, and then we will add in neurofeedback. Usually we will do some sort of assessment in terms of where in the brain the problem is. It might be a brain map, or it might be an online assessment such as the Neurocognitive Diagnostic Checklist, CNC 1020. And we will concentrate on the peripheral part of the cortex, and we will do a protocol that is either indicated by the assessments or a standard protocol, which would be more of an alpha protocol, which would be at PZ, and an alpha protocol would help the brain and guide it toward a calmer state so that the person will ultimately be able to breathe themselves into sleep at night.
Hmm. And how the average person, how do they respond for you?
Pretty well. It does take some practice, so we always tell them that we don't want them to try. We want them to actually participate in the training for at least 10 sessions to really either see and or consolidate any gains they might make in the ability to fall asleep.
Mm-hmm.
So the alpha waves are the slower waves in the brain, more of the brain's natural idle. And when people have anxiety or they feel wired or they are thinking too much, this is very helpful.
Mm-hmm.
We also might do some frontal training to reduce obsessive thinking as well.
Okay. And then how about with ADHD?
So again, we always like to start with some basic peripheral biofeedback training. A lot of the ADHD or ADD clients that we see are children, and we like to use screens that are very engaging, and so we will have them do some breathing as well, but more like they figure out how to cause the interactive screens to play, to make the cars go, or the trains go, the spaceships, whatever engaging screen we choose for them. And we will do heart rate variability or skin activity as well with children initially. And we might start every session with 5 minutes of that with kids and sort of a warm-up. And that helps them to begin to achieve a focused state. And then we usually go into PIR-HEG neurofeedback, which we can also determine through assessment, or just begin with that because we want to help them to enhance the ability of their prefrontal cortex to focus back to the seat of executive functioning. So if more blood flow and oxygen and nutrients can be guided toward that part of the brain, the research tells us that new neural pathways form and the prefrontal cortex grows stronger and the executive functioning is enhanced, and they can now sit in their seat in school and maybe actually go home and initiate their own homework.
Sounds very good. So it sounds like a lot of the stuff that that we're measuring, it's stuff that's going on inside the body all the time. But the biofeedback helps people be more aware of it and gain some control over it, and so that's a lot of what you're doing is teaching people how to do that.
Right. We want them to become more self-aware so that they can feel more self-control and empowerment. That really is the goal.
Mm-hmm.
And especially with the ADHD kids, we really like to do a QEEG brain map because then we can really see exactly what sites in the brain for EEG training are different from the norms, because the brain maps are normed for age and gender. So we can see where in their brain they're actually having a problem and then focus on that. And we can have all different protocols for that. And by the time they get to that, they've already learned some amount of self-regulation through this awareness with the biofeedback. And we have a pretty good outcome. Usually the kids with the attentional issues will come for a year, sometimes less, sometimes more. It really depends on the severity, of the condition.
Right. Well, that's great, and I one of the things that I always admire about you is that even though you do this as a business yourself, you're always encouraging other people to do it too. so
Oh yeah, thank you. Yeah, I do have about 6 people or more that I'm mentoring at this time.
Uh-huh.
Because I believe in this work, it helped me, and I want to see this work paid forward.
Great. Well, thanks a lot for calling in. I appreciate it. And I think it'll
My
be
pleasure.
helpful for people who are viewing this, and we'll be in touch. I appreciate it. Thanks.
Thank you, Harry.
All right.
Bye-bye.
Good night. Okay, so that was our second caller, and so that kind of leads into the insomnia piece here. So you can hear Susan talked about working with insomnia. It's rated as a level 3, probably efficacious. In '96, there was NIH assessment panel that looked at non-pharmacological techniques, including relaxation and biofeedback. And those produced improvements in some aspects of sleep, but there was some questions as far as the magnitude of the improvement in sleep onset and total sleep time, whether they were significant or not. But there are other work that showed more uh, positive results, more definite positive results. Here, this is talking about biofeedback along with progressive muscle relaxation for insomnia. After reviewing the quality of research using American Psychological Association research criteria, biofeedback was rated probably efficacious along with sleep restriction and cognitive behavioral therapy. There's more updated information here. In 2006, a task force of content experts was appointed by the American Academy of Sleep Medicine to perform a comprehensive review of the scientific literature since '99 and to grade the evidence regarding non-pharmacological treatments of insomnia. And recommendations were developed based on this review using evidence-based methods. Psychological and behavioral interventions are effective in the treatment of both chronic and primary insomnia and secondary insomnia. Stimulus control therapy, relaxation training, cognitive behavior therapy are individually effective therapies in the treatment of chronic insomnia, and sleep restriction therapy, multi-component therapy without cognitive therapy, and here biofeedback and paradoxical intention are individually effective therapies in the treatment of chronic insomnia. So biofeedback is listed in there. Here are references on the effectiveness of biofeedback for insomnia. And, of course, I don't expect you to be able to read all these references this quickly, but if you contact me, I'll be happy to send it all to you, plus additional information. So you can see there's plenty of information on biofeedback for insomnia. Now we'll look at ADHD. ADHD is listed as level 4 effectiveness. And here it shows a control study that was done in 2006, reported EEG biofeedback training was applied for 30 minutes, 2 times a week for 40 sessions. And the IVA, which is a test of attention, was used to evaluate the effectiveness of the EEG biofeedback training. And the results from 60 children indicated the overall indices of IVA were significantly improved. Then this is showing 83 studies reviewed to determine the status of treatments for ADHD. The results were shown as whether they were positive, negative, or inconclusive. 20 studies were identified for treatment of ADHD with EEG, and of those, 7 were determined to have acceptable methodologies, while 13 had marginal methodologies. The clinical outcomes of these EEG biofeedback studies was positive for 18, inconclusive for 1, and negative for 1. So on the whole, it was shown that it was positive. And then there's a lot of information of work that was done by Vincent Monastra on ADHD and was shown to be neurofeedback, or EEG biofeedback was shown to be very effective for helping children with ADHD. There are plenty of references again for ADHD and biofeedback and neurofeedback being effective for that, and these are listed here. Again, I can send you the detail on this if you just call me or send me an email. Now, I'll just mention a little bit about business models. So mainly, I would expect that most people are working in private practice. And so in private practice, a licensed healthcare practitioner can provide biofeedback independently. Also, sometimes people will work as an employee or an independent contractor for a facility like a hospital or clinic, and they might be licensed or they may work under supervision of someone who is licensed. And then for non-clinical applications, we've been talking about clinical applications, but for non-clinical applications where you just are wanting to help people learn how to relax or focus better, those types of things, then you can use biofeedback or neurofeedback for improving performance, and whether that's in work, school, sports, or performing arts. These are the basic common billing codes. You have 90901, which is biofeedback by any modality. It tends to be used more so in medical. So if you're dealing with headaches, you're dealing with pain, things like that, you might be working more with that code. If you're dealing with things like anxiety, then you might be dealing more with a 90875 or 90876, which incorporates psychotherapy and biofeedback. And again, once we talked about the income potential, I've just listed here again. So with the initial assessment, an average of 12 sessions. Now for some things like we talked about, for neurofeedback, usually you're talking more sessions, maybe 40 sessions or so, so the income from that is going to be higher. And also the assessments for that may be higher as well. The initial brain maps, as Susan mentioned, can range anywhere from $400 to $2,000, just depending on the detail and what's included and so on. And again, if it's something that you're looking to get started with, you would start out with training. Our training program is a 48-hour program, which is accredited by the BCIA, Biofeedback Certification International Alliance. And then equipment is going to range from about $2,000 to $6,000. Mentoring and support is going to be in the area of $1,900 if you're going through the certification. 20 to 25 hours of mentoring is required for that. And included in that, we can also do support and help you to learn how to use your equipment better. The certification, which are fees that would be charged by the Biofeedback Certification International Alliance, are about $425. And so I wanted to thank you for participating in this program. And if you want to move forward, or if you have questions or you want more detail, please call my office and give us your information. If you'd like to register for our next seminar, you can just give us a call or go on our website and register. Our numbers are listed here. The toll-free is 877-669-6463 or 914-762-4646. And if you mention this webinar, you can get a special unadvertised discount. The schedule is available on our website, biofeedbackinternational.com. If you want to send an email to me directly, you send it to harry@biofeedbackinternational.com. And if you just want to send a contact email to our website, once you log on to the website, you'll see contact us form there, and you can send us information there as well. So thank you again for participating in this webinar, and I hope to speak with you if you want more information or you're interested in moving forward with training and or equipment. And take care.